Spring is a beautiful time of the year, but it's also a time when the air is filled with what I like to call South Georgia snow, all that pollen. This is Dr. Tope Olarawaju, a Phoebe primary care physician. This time of year, do you see a lot of patients complaining of allergy problems?
Yes, I do. A lot of patients will come into the office complaining of the itchy eyes, itchy throat, runny nose as well. And a lot of times they come in thinking they have a cold. And I tell them it's allergies, and they're surprised.
What are the most common allergens? What causes these problems?
Pollen is very common around this time of the year. However, people can be allergic to dust mites as well, or also to pet dander. So some pet owners may have allergies to their pets. And also people can have latex allergies, allergies to medications, and different sorts of foods.
How serious a problem can an allergy be?
Well, allergies can cause anaphylactic reactions which can result in death. However, the seasonal allergies that we see are not deadly, but they're just annoying, and can cause inadequate sleep, which can cause other chronic conditions.
So if you're having a problem this time of year with the seasonal allergies, what are your best treatment options?
So the best treatment option is obviously prevention. And the way you can prevent allergies is pretty much staying indoors, keeping your windows closed during this time of the year, especially on windy days, because the pollen travels very far on windy days. And then also staying indoors, especially in the early mornings as well. And then if you do have allergies, a lot of people don't think they're serious, but it's important to get treated. And sometimes you can do just saline irrigations, which is just rinsing out your nostrils, especially at night when you've been exposed to all sorts of allergens during the day.
You mentioned before that some people come in thinking they have a cold. So talk to me a little bit about the difference between allergy symptoms and a cold or a sinus infection.
So allergies would usually cause itching, a lot of itching in the throat, in the ears, or in the eyes as well. And then they have runny nose as well. Now, if that is not treated, it can build into a sinus infection. And at that time, you have a lot of fluid pulling in your face. So causing a lot of pressure in the face. Sometimes it would have pain in the face, and then also headaches. You just feel like the head is heavier than it is, and that's because the allergies were not treated. And then cold symptoms are caused by viruses. And viruses, you can get them through, shaking hands, in contact with somebody that was sick. And once you have those, if you get plenty of rest and drink plenty of fluids, you should be fine.
Why is it important for us to know the difference? Why should I know whether my problem is an allergy or a cold or a sinus infection?
Because if you have allergies that are really a nuisance, they can cause other issues. Sometimes people have allergies that really wake them up at night and they find it difficult to go back to sleep. Not getting enough sleep can cause hypertension, it can worsen your diabetes, and so those sort of things, it's important to take care of that. Now, if you don't treat a cold with rest and hydration, it can build into a bronchitis or even a pneumonia, and you could possibly end up in the hospital. So you shouldn't leave those symptoms ignored either. And now with sinus infections, usually if you're treating your allergies fine, you should be able to avoid those fine. However, they could also result in missed days at work, kids staying home with you, and you obviously transmitting different viruses to loved ones.
Thank you, Dr. Olarawaju. That's all great information. If you'd like to see Dr. Olarawaju or another Phoebe primary care physician to check out your symptoms, go to choosephoebe.com.